My name is Petr Winkler. I'm director of the National Institute of Mental Health in the Czech Republic, and I'm also leading the WHO Collaborating Center for Public Mental Health Research and Service Development, which is housed in the National Institute of Mental Health. My background is in social policy, social work, and public mental health research, especially in health economics. I established the Department of Public Mental Health in 2015 and became a director of the Institute in 2021. My work is mostly focused on Central and Eastern Europe in terms of mental health care systems, services, epidemiology, and public mental health in general. As such, I was pleased to join EU-PROMENS and provide people who are coming to visit with knowledge and expertise that we developed not just in our research, but also when implementing the mental health care reform that has been started in the Czech Republic in 2013. And since I was at the reform at the very beginning, and I've been involved in implementing many of the reform implementation projects, then I can say that I have lots of to say, especially about the situation in Central and Eastern Europe and about transformation that these countries are going through. The specific characteristic of EU-PROMENS program, as it was designed in Czechia, is a focus on prevention and promotion activities and implementation projects that we developed in the National Institute of Mental Health or during the mental health care reform. So participants get to know about the whole context of mental health, including epidemiology, health service setting, healthcare systems in the region of Central and Eastern Europe. And from these general things, we go down the way and we see that the most promising approach how to improve population mental health is to start with mental health promotion and prevention, because there is huge population needs on one side and lack of specialized mental health care services on the other side. And this is not solvable by trying to increase the number of psychiatrists, for instance. What you need to do is to build up the system of prevention and promotion. So that's what we focused on. We have different aspects of that, starting from stigma, discrimination, mental health literacy, programs in schools, programs in workplaces, and then we go to specialized services that were developed during the reform, and participants have an opportunity to visit the community mental health centers that were established during the mental health care reform. The partner organizations are quite crucial. They are providing participants with the possibility to see how these organizations are working, and they are involving different organizations across the mental health care spectrum, starting from service users, advocacy organizations, up to the community mental health centers, which participants have an opportunity to visit. Well, probably the most significant was to see people from such a multidisciplinary background and from such a diverse cultural background, basically from all over the Europe, getting on the same page in terms of mental health and communicating different angles, how they see mental health in their practice, being it from teachers, social workers, psychiatrists, nurses coming from different countries, and being able to find a common language, sharing the common values, and sharing this drive to improve mental health care across Europe. The challenges are both unique and global that are shared, and the global are ever-increasing burden of mental disorders, ever-increasing needs. It's the globalizations and ever-increasing psychosocial stressors that are impacting our mental health, lack of mental health professionals. That's what is shared globally. Specifically here in the context of Czech Republic and in the context of post-communist Central and Eastern Europe, is that we have resources in mental health. We have quite a lot of psychiatrists, we have quite a lot of nurses, but they are mostly located, and the funding goes mostly to the old establishments, to psychiatric hospitals, long-term institutions. And what we need to do, and what is our specific, is that we haven't fully underwent this deinstitutionalization process as other countries did, such as Italy or Finland. This is difficult to say, obviously, because long-term collaborations need to evolve. What I see is that many friendships and relationships among colleagues are being established, and it remains to be seen when, if and when this is going to turn into some fruitful collaboration, into some projects, into some long-term activities. But definitely there is a potential. First, they need to apply, and I would like to strongly encourage them to do so, because I believe this is quite an interesting experience that might bring new perspectives on their daily practice. And in terms of preparation, I would suggest to read something about the specifics of mental health care systems in Central and Eastern Europe, to learn about the specifics, to be better prepared for how the mental health care system looks like here, so they would have an opportunity to ask really detailed and specific questions, because they have an opportunity to meet experts from different fields. Our institute has experts from psychedelics to service users, mental health promotion prevention experts, people working with those who have disorders of sexual preferences, etc., etc. And it's a wonderful opportunity to ask questions in that specific areas and to make most of having these experts on board. Just thank you for the opportunity to have this program, to have people who are coming as visitors, because that's a wonderful opportunity to discuss the topic that is common to us, but that we experience from very different angles and in very different settings.